Sawa na contraceptives.
Yes.
Niliambiwa there's a science to contraceptives, and here is another area the gynae is involved sana kwa contraceptives. The types of contraceptives. Of course najua wasi wa mtaa kuna ile wanajua inaitwa withdrawal. Kwanza kuna mse alikuwa ananiflosia juzi by the way. A colleague aliniflosia aliniambia ati yeye utambua hiyo peke yake. Amework nayo for I think 8 years na imekuwa 100% effective. In fact kwanza yeye alikuwa ameniambia amefika expert design, yeye utoka mapema. So as in reduce chances kabisa. Yeye utoka tu mapema anaenda
home.
Anaenda delivery. Actually withdraw and deposit place ingine. As in the locations are different. So how does one choose the effective mode of contraceptive?
Well, it depends with the patient. You give her the options we have. So we have long-acting, short-acting contraceptives. Okay, so it depends. You just talk to your client and give them options. Like types of long-acting, we have IUCDs, the coils, right? Yes, and Jadel, implanons. Then short-acting, we also have many in that group as well. Yeah.
Hakuna terms zenye zi sound kwa around kwa mambo ya measurements.
Yeah, measurement. No, why it's long, it's the effectiveness.
Okay.
Yeah, it takes more years to work. Short acting you can remove after some time, then you resume your fertility.
Okay. Yeah. So factors zenye zina depend na hii ina depend pia na patient.
Yeah, depend na patient. Kama patient kuna condition patient akona nazo, you can't give certain contraceptives. Kama ugonjwa hypertension, kuna hizo ambazo hatupeani, diabetes as well.
Okay. Na P2 kuna wasi wamekuwa wakicomplain hata ukiget origi kuna time ina backfire. What's the science?
all these contraceptives are not 100%.
What do you mean?
Kuna failure rate.
For real?
Kuna failure rate. Yes.
I have a theory. That mtu ukitumia contraceptives yenye iko kama 98% na mtoto atokee, lazima ata make it to the top 2% of the nation in terms of as in making it against all odds. As in 98% na mtu bado akapenya na
akapata.
Would that make sense? As in najaribu kufanya kitu about science na anatomy ya binadamu. Would that make sense?
Yeah, it happens. Yeah, we have people we've given contraceptives and they still deliver. So it happens. That's why when before we give the client, we tell her, but it has this percent failure rate. It's not 100% that when you use this contraceptive utapata mtoto, unless ni permanent. We tie your tubes. That one is now 100%.
As in, when you tie the tubes,
yes.
I'm assuming the procedure ni hiyo tu vile unasema.
Yeah, it is surgical procedure.
Inakatwa mayai huko.
Tubes ni kwa dem tunafanya ligation.
Hata madem mimi nilikuwa nafikiri ni
just like vasectomy in men, we have ligation of the tubes in females. Yes. So then we tie the tubes, and that's a permanent mode of contraception.
Ni kama kublock wase kwa Twitter. As in I'm assuming for example kama vasectomy, I don't know the science, but inamaanisha ninizi ukam okay, nini zikifika lakini zinaenda wapi?
Kuna ukuta. Zitapata tu ukuta hapo.
Zina back to sender. Isn't that unhealthy?
Unhealthy why?
Juu unakuanga unatembea na accumulation over time
Mtu unataka kutoka.
Wewe uko na mayai yenyewe haina place ya kutokea zinwe.
Hizo tu zina dissolve tu kwa mwili nazichukua.
Oh, inaingia sasa. So watu hiyo wameingia huko. So basi what's the 100% effective form of contraceptive?
Hiyo ligation.
Hiyo ndio hiyo pekee yake. Hakuna ingine.
For female bilateral tubal ligation, for men vasectomy.
Na vasectomy ni irreversible.
It's irreversible, but I don't know.
Watu wamejaribu lakini
kama wamejaribu kureverse.
Kuna techniques zenye watu wamejaribu kutumia kureverse. So sijui venye data inakaa, but Kuna watu wanajaribu.
Surgery ama plumbing? Manzi. Na we sahi tusha establish lazima useparate professional na job yenyewe, si ndio?
Sure.
What do you do? What's the fun part of your job?
For obstetrics,
Na usitudanganye.
I wouldn't lie. For obstetrics, just seeing, walking along with a pregnant lady from first trimester, second trimester, third to delivery. You see the kids, it's interesting. You feel like you're a mini god.
Okay.
It's a good feeling.
And you'll be sure to separate separate job na professionalism even if your crush came in as your client.
Yeah, sure.
Ukweli ama uongo? Ukweli ama uongo?
Ukweli. Professionalism kwanza.
Actually hiyo time uko na stress.
Kuna stress ya kazi. You don't even think about anything. You become very professional.
Mwanaume at that point uko na stress. Sivyo ndio watu utoa stress ama? Hii point yako ya stress ni nini?
Na vile tu yani unafikiria ni madawa gani zitakaa, ni surgery utaifanya aje? Unajua like kama vile ulikuwa unaniuliza, si unajua the first thing dem anakuja kwa ofisi tunamwambianga toa nguo. Unajua
Haki ya nani? Mesikia the first thing. Ninyi mkienda OC mnaambiendeni mjaze sijui nini. Sasa toa nguo alafu
after hiyo process yote kuna kutoa nguo, unaona? So unaangalia kila kitu. So kuna breasts, kuna tummy, nipple,
choices.
So unafanya maths zitaingiana aje? Kila hii shida utatatua aje? Complications zinaweza kuja ili unaweza solve, unawezi. Sasa hiyo anafikiria wewe ni god.
Okay.
So hapo hata I doubt
hakuna anga nini?
Normally hata ukiniuliza nimeona nini
Sikia. Na let's be human for a minute. Let's be human for a minute. Umeshapita hiyo procedure yote, alafu umenoki client by natural causes. Would you go ahead?
Do what?
As in, if you like the client, as in we don't have stories at my husband was my gynae. Hakuna, as in we don't.
Ziko hizo hatukatai, but sasa unajua lazima uchange now your doctor.
You have to change.
Yes.
Now I have to. This is very selfish. Now this is very selfish of the gynae community. You cannot examine your wife. That's what you mean?
Hapana, hata mimi siwezi.
No, ati uwezi?
Siwezi examine my wife.
Ni yako. Why?
Like hata kutreat
my
wife or my immediate family.
So that's
impossible.
Like in school ya kuambia wasee ni aje kila mtu lazima angaliliwe. As in wewe hata ukiwa na wife yako you can't trust yourself with the 6 years as in you learn. So mtu akija kwa bibi yako it becomes different.
Because the emotions.
Yes, you love wrong judgments. Something small you'll magnify it. So yeah, you'd rather let her be seen by another gynecologist.
Because hata unaweza itest.
Kama breaks iko sawa.
Manze kama iko sawa.
No, it's different.
It's not allowed totally.
It's not allowed.
Code of conduct, yeah.
And how do people take care of themselves? Wasijipate na tuseme both men and women wasijipate na hizo ma UTI nini.
So hygiene is very key. Yes, so for ladies, how you clean your genitals, we advocate for front back fashion. Then for your undergarments, use cotton panties because cotton will absorb the moisture. Okay. Yes. Then we avoid douching, use of perfumed soaps. Okay, because these soaps will interfere with what we call normal flora around there. Okay. Then in case you're using public toilets, disinfect it with locally available antiseptic, Jik, Dettol.
The toilet.
Yes, the toilet, not the lady.
Sawa. Sawa.
Yes, and peeing before and after intercourse is also
After eating?
Peeing before and after sex. Yes.
You have to. Hiyo ni kama kuclean.
Yes.
Na
Then take lots of water just to clear the bacteria off your system. Yeah.
Okay. And the first question was kama your personal life would creep into the professional life. Have you ever gotten yourself to a point where the professional life has creeped into the private life? You are having a good time, alafu unajipata tu compliment mtu na lugha ya job. Nice genitals. As in, does it happen? Does each affect the other?
Yeah, it's because most of the people hang out with our medics, so most of the time we just use medical.
That's actually a thing.
Yeah.
As in, that's actually a thing. It's a very nice genitals.
It's normal.
Unaweza ambia Ken, mazee your rectum joe. Okay, so you are nini machali? Machali ndio you should pee after.
No, madam, both sexes.
How does that help?
Just help, during sex there is,
Yes.
So bacteria might travel from the anus to the urethra.
Okay.
So then peeing, urine is a culture media for bacteria colonization. So once you pee, that bacteria has nowhere to colonize. Okay. So you have to pee before and after.
Yes. I think that's good, Maze. So if I ever find myself in that position, I have to pee with an agenda. Piga pressure, unapiga pressure ni kama car wash.